One of the reasons that I was very attracted to moving to Dayton was that there was a great need here for providers to provide tertiary level cancer care and reconstructive care. There are a lot of general ENT physicians here, there are a lot of oncologists here, but actually in the whole Dayton area, there are no subspecialized head and neck cancer surgeons, there are no subspecialized facial plastic and reconstructive surgeons. And because of that, I felt that it would be a great service that I could provide to this community. One of the things that I feel that I can offer my patients is that I can provide comprehensive care to them. I like the idea that if I'm seeing you and you have a cancer diagnosis, I can speak with you from the removal part of it as well as the reconstructive part of it. The Comprehensive Head and Neck Cancer Program is basically a pooled consortium of all of the resources a patient would need to successfully navigate and get treatment options for their cancer diagnosis. The reason the Comprehensive Head and Neck Cancer Program is a real benefit to patients is because prior to this program being started, one of the issues that we were seeing was that this area has a lot of patients with advanced cancers. And many times they were being seen, maybe even worked up, but they would have to be sent to either one of the nearby universities or nearby cities for further tertiary level care. And one of the issues surrounding cancer care is that it is such an intensive and a involved process that it's quite difficult for patients and their families to make these trips to faraway areas to get comprehensive care. If you had to have treatment for something, for a major life-changing diagnosis, but again, in the setting of your home, a location that you're comfortable with family and friends nearby, and also knowing that you wouldn't have to make major arrangements to travel hours and hours away, it would just make for a much more smoother process. I have found it extremely humbling, and the more that I practice medicine, the more challenging patients that I work with, the more and more I find myself humbled. There are so many forces beyond my control that are at play in making a certain outcome happen a certain way. And whenever I see a patient, I am reminded of that constantly because I recognize that it's not just me that is involved in your care. There is something far greater than me that is going to be of influence here. What I can guarantee you is that I will give you 100%. I will give you my mind, my hands, my heart.